This Behavioral Health Academy really focuses on in-classroom instruction on how to treat people holistically and the on-the-job experience of being able to take what they learn in the classroom and immediately apply it.
You're going to be able to actually do the work of becoming the kind of therapist that you want to be.
As a BHA student, you really are like taking on the role of as a therapist with supervision.
The BHA offers that practical, real-life practicing part of it that you're not really getting with just going to school.
From the genesis of the Behavioral Health Academy, we realized that at least 3/4 of people coming to us with a mental health diagnosis also had a co-occurring substance use concern.
The Behavioral Health Academy has been integral in really taking a look at partnering with the universities to ensure that there's a co-occurring curriculum so that when they come out, they really are prepared to service someone holistically for substance use and for mental health.
The biggest way this helps our hiring managers is by having this internship experience. We get kind of an on-the-job, long-term interview with the prospective employees, the interns. How it helps the interns is we are able to give them an experience where they're able to take what they're learning in the classroom around evidence-based practice and co-occurring service delivery and replicate that in their real-life working experience within our clinics. So they learn something and then they can practice it immediately in our clinics.
Being able to have the instruction from the BHA has given me a lot more confidence, and I just feel like that's really gonna not only help my clients but help me build that rapport and feel more confident in my first job.
There's not many opportunities like this to be able to one, be on track to later on possibly have employment for whatever positions are open at the time, but also if you want to go after that clinical license and get your like LSW.
I have been lucky to have several Academy students come and spend their practicum in the Shelbyville outpatient clinic and then transition into employment with us. So it's been a really good experience for me over the years, being able to see, the students grow during their practicum and then take on that role as a therapist once they graduate.
I definitely think the Behavioral Health Academy is a great opportunity. Not only do you get access to all of the positions available at Community, Eskenazi, Aspire, and other community mental health centers, but you're also, like I said, getting that extra support.
Our internship program really helps prepare these individuals because we actually give them the experience that they need in order to provide that holistic care to individuals that are suffering from co-occurring disorders.
I don't feel like you are treated necessarily like a student. I mean, you come on and they are teaching you the job, hoping that you will hopefully stay on with them.
You trust in the knowledge that you learned with the Academy and getting to use it with real clients.
I've actually gone ahead and accepted a job at the position that I was interning at, in the exact same role that I was interning at.
I've even accepted a position already at Community, and I'm excited to get started at the end of my semester.
I don't think we would be where we are if we did not have our Behavioral Health Academy.